The case count in Ontario is growing rapidly. It has nearly doubled since an outbreak of the disease started last October. The total for Ontario this year now sits at 119 lab-confirmed cases. There are 23 more probable cases. Compare that to the prior decade, where between 2013 and 2023, there were 101 total infections.
It's extremely contagious and it's spread through an airborne route. So the virus could even linger in a room after someone's left the room, for example, and you may not actually even know it.
The effects can be very serious.
Someone who's compromised can have measles pneumonia. Compromised kids can have blindness. There's all kinds of problems that can occur with measles. That you can get measles virus going into your brain and causing encephalitis.
The current outbreak in Ontario began in the fall, connected to a travel-related case from New Brunswick. New Brunswick declared its outbreak over on January 7th, but in Ontario, the disease is rapidly spreading. Quebec, too, is facing an outbreak that has been active since December. Public Health Ontario says all the cases in this outbreak are in people born after 1970, with the majority in children and teens. 18 kids have been hospitalized as a result of the outbreak, including one who required intensive care. Nearly 90% of cases were in unvaccinated people.
You should really take every opportunity to check to see if you're up to date. Other than kids getting their routine vaccination, up to date is if you're traveling, that's a good time ahead of any travel like March break.
When asked about the rising numbers, Health Minister Mark Collins says people need to trust science and the medical evidence that the vaccine is safe and effective.
If we can witness measles come back specifically because people aren't getting vaccinated, then they're putting the lives of their neighbors and their community at risk.
Kathrine Ward, Global News, Toronto.